Perfect. We're
رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome to the SG Sayyidaat Global talk show. Assalamu alaikum, my dear.
Wa alaikum assalam. How are you?
Alhamdulillah, I am fine. Viewers, today in my studio, I have Dr. Zahra Ahmed. She has done BSc in chiropractics. She's the doctor of, in fact, chiropractics. This term is new for me. I hope I pronounced correct.
Chiropractic.
Chiropractics. Okay, my dear. Okay, my dear. We would love to hear more. We would love to know more about you. I would appreciate if you would tell us more about you, like where are you from? When did you come to Saudi Arabia? Where are you working right now? Your credentials, your experiences, everything that you want us to know about you.
Okay. So, hi everyone. Assalamu alaikum. My name is Dr. Zahra Ahmed. I'm a chiropractor by profession. So I was born and raised in Saudi Arabia, in a city called Jizan. Then when I was 14, 15, we moved to Malaysia, Kuala Lumpur, Malaysia. And that's where I finished my high school, my college and university. And that's where I graduated as a chiropractor. I graduated from International Medical University in 2017. And then as soon as I graduated, I came back to Saudi Arabia where I started my career as a chiropractor. I currently work in a private clinic that caters to only women and kids. We are a mix of chiropractic and physiotherapy because the idea is if you combine both, the patient gets best of both worlds and improves better. So I've been working here since I started since 2017 until now. I'm with the same clinic. It's called Muruna Clinic, and it's situated in Suleimania. So actually we are the one and only chiropractic and physiotherapy center in all of Saudi Arabia, especially
Dr. Zahra, are you there?
Yes, I'm here. Yes, I'm here. Yes.
Okay.
So as I was saying, we're the only all-female and children clinic that is a chiropractic and a physiotherapy center in all of Saudi Arabia. Yes.
Okay.
That's a little bit of.
Would you like telling? You just told about physiotherapy also. Are these both these fields, the chiropractic and the physiotherapy, are these different from each other? How can you relate these?
So chiropractor, in a brief description, a chiropractor is someone who focuses on the spine and the pelvis and the joints alignment so that there is no interference within the nerves. So we do something called chiropractic adjustment or spinal manipulation or joint manipulation. Physiotherapy focuses more into muscle work and exercise and rehabilitative work. So that's the big difference between chiropractic and physiotherapy.
Sorry to interrupt you. Your photo, your pic is stuck here. Can you move your camera?
Can you see me?
It's stuck.
I see you clearly.
I don't know. Maybe. Okay. I can see, but it's, your photo is stuck. I can hear you, but.
Okay.
Okay. And what is an adjustment?
So a chiropractic adjustment, it's used by a chiropractor to reposition the bones that are out of proper alignment. So when you have the spine, you have so many vertebrae that sits on top of each other. So when these are out of alignment, you use something called chiropractic adjustment. And these alignment, in another word, it's called subluxated.
Okay.
So there are various techniques of adjusting the actual vertebra. And depending on the patient's age, the condition, and the doctor's training, any of these techniques may be used. The purpose of an adjustment itself is to remove any interference to the nervous system, which improves the whole spinal function and the overall health. So chiropractic adjustments are very safe for all ages and are completely natural. So because we're using our hands to do the work.
Okay, you mean they are safe. Okay. And
Yes.
what makes the sound during adjustments?
Actually, adjustments do not all produce sound. However, some techniques that do create the popping sound, and this audible release is as a result of the gas is shifting within the joint. So we have nitrogen gas within the joint itself, and once you move or you reposition a joint, these gas gets released, and it makes the popping sound effect. You know when you crack your knuckle, how it popped? The same concept, and they are painless and causes no harm.
Okay. Are these addictive?
Um, Chiropractor is no more addictive than when you start exercising, when you do proper diet, or even brushing your teeth. Chiropractors, they recommend getting your spine checked for subluxation or that misalignment within the joints itself periodically throughout your lifetime because it is healthy for you to do so. Because if you have an improper or misalignments within the joint, that nerve itself doesn't get to do its full function. Patients sometimes they can undergo long-term chiropractic care and they report an overall sense of health and well-being far beyond even when you do a proper diet and exercise.
Okay. And how do you get these subluxations?
Subluxations, that's a good question. There are three causes of a vertebral subluxation or a reason why you would have a shift within the joint. A physical stress on the spine and the nervous system. It may include like when you slip, you fall after giving birth, motor vehicle accidents, repetitive motion, and improper sleep. So some people who sleep on their tummy, some people who like to sleep on top of too many pillows on top of each other. Another cause would be chemical stress, like smoking, alcohol abuse, or not even drinking enough water, improper diet, overuse of drugs and medication. And last but not the least, emotional stress. A major cause of subluxation is due to its effect on the hormonal and the muscular system of the body. But regardless of the cause, this subluxation needs to be detected and removed from the system.
Okay. But how would you say that anyone would be able to say that she's facing subluxations?
How can they tell? You
Yes.
can have a subluxation and not even know about it. So there's no
Hmm.
specific signs and symptoms for a subluxation. But it's like an early stages of tooth decay. Subluxation can be there for a long period of time before any symptoms can emerge. Only a chiropractor has a specific training because we have to go through the spine itself and check by range of motion and pushing on the vertebrae itself to detect the subluxation. Another way is if you use special techniques like X-rays, postural analysis, where we check, yani, your neck is forward, your shoulders are rounded. These are one of the ways a chiropractor can determine whether or not you have a subluxation.
Okay. And why do chiropractors take X-rays? Is that important?
Not all chiropractors take X-ray. Like I said, there are different techniques. There's a chiropractic technique called the constant, and they rely mainly on X-ray. But in order for a proper diagnosis and a condition, an X-ray are commonly taken, just to rule out any other conditions like cancer, fracture, dislocation. And these X-rays, they sometimes use it also to check the vertebra misalignment because you can see from the X-ray if your vertebra is rotated or shifted. You can check if there's disc degeneration. So when they say you have hernia or you have one of the vertebra has slipped backwards, usually after an accident. or any other serious pathology. But many chiropractors use it basically to document the progress of a patient. So when a patient comes in with, for example, a very straight back, a chiropractor, if you do a long-term treatment of chiropractic care, it helps to show the patient the difference between before and after the treatment. Yeah.
You must have seen that a lot of the women after pregnancy, they complain about this disc problem at the
Yes.
back.
Yes.
So what is your say about this? How they, what precautions they can take to get rid of this, or what they have to do? Who do they have to consult? And
Yeah. So usually after pregnancy, because of the change in the gravity itself, it puts load and stress on the spine and the pelvis. And because of the hormonal changes, the ligaments and everything becomes lax. But once, even during, before, or after pregnancy, a chiropractic adjustment is very useful for the pregnant women because it helps to keep everything in its place, eliminates pain, and it helps even for the fetus or the developing baby to sit properly where it needs to be sitting. So even after pregnancy, it's the best option to come to a chiropractor, do proper examination, check what's causing the pain or the sciatic symptoms in the leg. Yeah.
so, does it go with the time? This problem?
It goes with the time. It goes with time. As long as we do a progressive and consecutive sessions back to back, and we stop the thing that's causing the pain. For instance, your core is not strong enough, or you're having bad posture, especially when we're changing diapers for the baby. We tend to bend forward. Sometimes when we want to lift stuff from the ground, we don't care and we lift all the way up instead of bending our knees. So if you don't follow the proper precautions to help avoid the cause of pain, all pain usually goes.
So, do you recommend exercises also? Like besides these therapies and all, do you suggest some?
That's why we do a mixture of chiropractic and physiotherapy, because once we realign and everything, we want everything to hold, and we don't want the misalignment or the vertebral subluxation to come back. So the best way to do it is through rehabilitation and making use of your muscles to hold your spine in the right posture or the joints in the right posture.
Yes, yes. Thank you. Can patients with arthritis receive chiropractic care?
Patients who suffer from various form of arthritis may get significant results from chiropractic care, especially depending on the patient. The result itself may vary. However, by keeping the joint itself to move freely, the inflammation or the stiffness that is associated with arthritis is minimized. So what happens with arthritis is because the joints are inflamed and then there's a narrowing between the joint itself. But once you get adjusted, these joints move freely and you feel less stiff. And it also helps relieve some of that inflammation because it's compressing on the nerve itself. So arthritis can definitely get some sort of relief once they get adjusted. And usually with arthritis, we do work with other professions because sometimes they need medication. So I cannot only say chiropractic is the only goal and the only way. The good thing about our profession is we appreciate other medical members to join the team. So we work as a team member. So if arthritis doesn't improve with chiropractic care, maybe she needs some certain type of medication. Maybe she needs another type of conservative care, let's say homeopathy, let's say hijama, let's say Chinese medicine, let's say a medical doctor who will prescribe her medication. So we look at the patient as the center and we provide all the necessary treatment. So the thing we do best is also referral.
Would you like differentiating between this acupuncture and chiropractics?
So acupuncture is another type of profession where they use acupuncture needles. So there are these thin, very small needles, and they use the energy of the body. It's called the chi energy in order to realign the energy of the body. It's a completely different profession, but sometimes when a patient says, I've been adjusted a few times and I don't feel there's a difference and she has some sort of emotional stress, then I would say maybe go ahead and try Chinese medicine or acupuncture. So it all depends during the session. When you review your patient's case every time, there are specific symptoms they tell you that would make you think, yes, I think she needs to go to this professional, or yes, I think she needs to go here, in order for her to benefit from the adjustments that we provide.
Okay. And can a person with previous back surgery see a chiropractor?
Unfortunately, some of the research, they show that up to one half of those who had final surgery, they usually have a relapse of their original symptoms. So one example would be disc. Everybody has disc. 80% of the population have disc, but they're not symptomatic. But because most of the doctors see on their MRI there's a disc protrusion, they immediately diagnose it as a disc, and they say, you know what, let's do surgery. But that just having a disc on an MRI doesn't necessarily mean that's the root cause of your issue. It could be the vertebra that's misaligned, that's impinging the nerve. It could be the muscle spasm. It could be the sciatic nerves of the leg that's impinged. So unfortunately, most of them report the symptoms comes back within a month or a year. But this common reoccurrence, it's called they have a name for it. It's called the failed back surgery syndrome, or usually it's a result of unnecessary or additional procedures to the spine. So it's like you're introducing more physical trauma to the spine itself. But chiropractic care may prevent a repetitive surgery. So instead of you saying, you know what, the symptom came back, let me go back again and do the surgery, the best option would be like, no, I would go try chiropractic, physiotherapy, or any other conservative care just to help me with the pain. Usually the best option is try conservative care for at least 3 months. If you feel like your symptoms are increasing, then we would say within the treatment session, we would say, you know what, I think a surgery is an option. But you only say a surgery is an option if you see certain red flags. These include night pain, a pain you get at night, uncontrollable weight loss. Suddenly you're starting to have weight loss, uncontrollable bowel and bladder incontinence. You start to feel bilateral, both leg weakness, and you cannot walk, constant pain. You cough and you sneeze, you feel that spasm or the electric shock down the leg. So there are certain red flags. I, as a chiropractor, would ask the patient if they have these symptoms. And if they report such symptoms, I would say, you know what, no, go ahead and do the surgery before it gets worse, because it's actually impinging on your spinal cord. But if it's a mechanical low back pain where she says, you know what, I wake up in the morning with the pain, I can't do my physical activity, I used to stand for too long, now I cannot stand anymore, I feel stiff. All these are general mechanical pain. And you see she has a disc and it impinged the nerve, but she's not telling you the symptoms that are so bad that you would suggest a surgery. No, you would definitely prefer to benefit from a chiropractor or a physiotherapist or any other conservative care out there besides surgery. But we usually tell the patients, try 3 months of conservative care, then only think about surgery.
Very informative. Very informative. Yeah. Thank you. Thank you. Okay. Is it okay to see a chiropractor if this is a sister here as a viewer, she is asking, is it okay to see a chiropractor if she is pregnant?
Pregnant women usually get amazing results from chiropractic. Chiropractors there are specific chiropractors who train to adjust pregnant women, and it's called the Webster technique. So you get trained to specifically cater to pregnant women. Because of their inability to take medication, the best option is always a chiropractor, and because it's a natural approach of a chiropractor, it's the most logic choice for a pregnant woman. And more and more OBGYN doctors are starting to refer their patients to a chiropractor because they see the effectiveness of a spinal adjustment as a pain relief. Also, there are certain techniques designed to turn a breech baby. So usually when you have a breech baby, a midwife would be a best option to help you turn. Chiropractic adjustments are also another option, and it's safe and it's effective. And lastly, women under chiropractic care, they have significant faster delivery than those who are who haven't had an adjustment.
Oh,
Makes labor easier. Yeah.
this is new information for me. Thank you for that. Thank you for that. Okay, my dear. Do children need chiropractic care?
Children, even in today's natural childbirth, the method they cause spinal trauma, especially when they're pulling the kid or the baby out the improper way. And studies have shown that that the infertile colic or poor appetite or an ear infection or inability for the baby to sleep are some signs of spinal distress within the newborn baby. So when a mother comes in and she says, "Oh, my kid keeps having ear infection," "Oh, my kid cannot sleep," "My kid has poor appetite, doesn't want to eat anything," so that's a sign that, or signs and symptoms that makes you think, you know what, maybe the spine itself is not aligned and there's a stress on the nerve itself. For pediatric adjustments, they are very gentle, literally a one finger push. They're safe and they offer a drugless alternative that many patients prefer, because it's sad to have a kid take medication for a pain that is easily fixable, especially with a gentle and a safe approach. Even pediatricians here commonly they refer to a chiropractor to give the child at least an option for a natural approach in order for the infant to grow to not have any other health problems. Yeah.
Okay. The sister here, she's asking, do I have, how would she know if she has this slipped disc problem or pinched nerve problem?
So some of the signs and symptoms of a nerve problem is numbness, tingling, and if it's impinged on a certain level, it will have a certain pattern of radiation of pain. So depending on which level of the vertebra the nerve is impinged, you would say, you know what, my pain starts from the low back, it goes to the outer side of my thigh, and then it goes into my calf, into my leg. So it gives you a picture of which level it's impinged. But the disc itself, they are known as the shock absorbers of the spine, and they're made up of a fibrous ring, like a cartilage outer ring, and a jelly substance inside. So there are many disc problems throughout the spine, and some of these are generally referred to as slip disc. And it's not necessarily the disc is slipped, it could be impinged from the middle, it could be impinged from the side, but they are generally termed as a slip disc because it's a layman term. The disc cannot actually slip out of its place because of the way it attaches to the vertebral bones itself above and below. So you won't see a disc that goes slips outwards. What happens is, because of the bad posture, sometimes factory workers who do rotational motion, it causes wear and tear within the cartilage in the disc itself. So that wear and tear, the decay, it starts to tear up the area, and the jelly substance within the disc starts to leak out. So the thing that's protruding out is the disc material within the ring itself. So this is the one that causes impingement in the nerve, which causes the numbness and the tingling and the irritation and the inflammation and all that problem. But an actual disc, the whole content of a disc cannot slip out.
And this nerve problem, the few of my friends, I've seen them complaining about the numbness of their hands. So what do you say? Does it require surgery or maybe therapies, or how can they fix this problem?
So a pinched nerve is a very rare occurrence. You would hardly see someone who has the exact symptoms of a pinched nerve. But most likely the pain a person is experiencing is an adjacent the vertebra itself that is out of alignment, which is causing an irritation or slight compression or stretching of the nerve itself. Because within the spinal cord, for the nerve to protrude or come out from the spinal cord, it goes through a ring. So when there's a shift within the bones itself, it causes the ring where the nerve goes out to be compressed. So what happens? The nerve itself gets pinched or compressed, or it gets overstretched, or it gets irritated. So these misalignments itself are called the vertebral subluxation, and it can distort the impulse of the nerve itself, being sent, for instance, from the brain to the body, because all our nerves are sent from the brain to the body. So it disturbs the nerve flow, and it doesn't innovate or doesn't do the job it's supposed to do. For instance, it's supposed to help with the muscles of the chest. If it's impinged, it won't supply the muscles of the chest, and you'll start feeling the muscle itself start to ache. Yeah, but any interference to the nerve signal can produce disorders within the tissue and the organs itself. Yeah, so you actually feel the symptoms of an irritation of the nerve or compression of the nerve.
If someone is facing this nerve issue, would it fix the problem if she wears some sort of this special glove that you can suggest for such people with this issue?
The thing is, once the nerve is compressed and you start using a compression glove or something, you're encouraging the compression. Once you start compressing, the nerve responses to become more inflamed and more irritated. So you might feel relief while you're wearing it because it's numbing the whole area. But as soon as you remove, you feel weak, you feel heavy, and you feel more irritated. So it's actually causing the issue to become worse. Another example is when people with low back pain and they use back brace, the back support.
Yes.
The back support, it encourages the muscles to become flaccid or not work, which causes the muscles to start to become weaker. So once you remove the back brace, your body is used to that support. So you feel weak, you feel more irritated, and doesn't help solve the issue. You even see patients who wear the back brace for about 10 years, and it just makes their spine or the degenerative changes with the spine get worse, even though they're at a young age where their spine shouldn't be looking the way it looks on an X-ray. Yeah.
Yes. Okay, the sister, she's asking, working in KSA, what are certain requirements I need to have before seeing a chiropractor?
So here in Saudi Arabia, we don't have a licensing body. So we don't have the choice of when a patient comes in, we immediately treat them. Hopefully, inshallah, in the future, this changes. For now, we need the patient to go see an orthopedic doctor or any spine-related doctor to write them a referral letter. So basically says this patient needs a chiropractic adjustment before she comes in. And we would also prefer her to come in if she has her x-rays or MRI, just to give the patient a clear picture of what's going on. So a referral letter is very important for us to start the treatment. Your x-rays, your MRIs, or any other medical reports that you have.
Okay. Does all the hospitals here in, we would talk about Riyadh here as we are here in Riyadh. So all the hospitals, they provide service for chiropractics?
As far as we know, we are the only chiropractors who cater to women and kids, and we combine chiropractic and physio. There are male chiropractors in different clinics. So like we have Dr. Mario in consulting clinics. We have Dr. Mohammed Sulh in SMT. So it depends. But if you want a female, we have two chiropractors, myself and Dr. Daniel, which we both are within the same place.
Okay. Does it covers under insurance? Like if people who cannot afford?
Currently in our clinic, we don't accept insurance, but one thing we ask our patient to do is to call their insurance company and see what the insurance might need from the clinic. Sometimes they just need a report for us to write and the patient can claim. Sometimes they need receipts or invoices for them to claim back their money, but it depends from insurance to insurance. Yeah.
Okay. This Mariam Qureshi here, she's asking, what do you think is the main cause of the relapse?
after a surgery.
Yeah.
After surgery, yeah. One of the reasons, first of all, it's improper diagnosing. Like I said, it's not the reason that you have a disc, you get pain. And most of the people have disc and it's asymptomatic. It could be because of that impinged nerve that's causing your pain and you need a alignment. It could be. So once you do a surgery, you're introducing another form of physical stress into your body. So while your body might heal from the surgery itself, you haven't solved the issue. So for instance, if you fall again, if you got pregnant, if you sleep wrongly, it causes more stress to the issue, and it might not even cause the same area to be having a prolapse or a herniation. It might cause the vertebrae above or below to start acting up because it put uneven pressure on the spine itself. So it could be, again, from emotional stress, physical stress, or chemical imbalance within the body.
Okay. What do you think? Would you suggest like more females should come and join this profession? How do you see this profession?
I think everywhere in this world can use a chiropractor, but I do think it's an alternative option because everybody suffers from low back pain. And not and my thing is, I don't like when patients say I have a low back pain and I've been having it for so many years, and their first option is to do surgery. So I do think we need to do a better job of having our doctors, medical doctors, orthopedics, start to know more about chiropractic, so because they are our primary care. So when a person has pain, the first place a person thinks about is going to a medical doctor. So I think if a doctor itself can give options for their patients instead of telling them, let's go ahead and do the surgery because I think it's the surgery that's causing you the pain, I I think everybody will be better off going to a chiropractor. Another option is referral. When we have a patient who has come to the clinic and has benefited, I think you you do a service to the community like what you're doing right now, making everybody aware of the existence of such a thing. So a community service like yourself, having Facebook groups where women can discuss like what their options are. Another option is don't always stick to the first opinion by a doctor. Always go for a second or third opinion. So if this doctor said yes, you need surgery, then then most patients would say yes, I will follow what the doctor told me. No, make the initiative to go to at least the second doctor, third doctor. If they all say the same thing, maybe they're looking at something, a bigger picture. But in most cases, not all doctors have the same opinion. At least the second one would give you an option, or the third one would give you another option.
Okay. What advice would you like to give to the students, like if they want to join your profession? What is the scope of this profession, and how famous is this, and how much like they are paid? Are they highly paid? Because these are the points that people look into it when they want to go into a specific profession. So, are they highly paid, and what are the education requirements? And are there schools in Saudi Arabia or Riyadh that they can go for?
Okay. So it's a very rare profession and it's mostly common in the Western. So if you go Canada, to the US, Australia, Japan, Korea, Malaysia, there are certain number, a handful of universities that provide the course. For you to become a chiropractor, you need to graduate from a university that provides the degree itself. It's a 6 years course and it's science based. In my university, the first 2 years you study with the medical doctors. Then you go, the chiropractors go a separate way and continue with their practice doing adjustment stuff. Medical doctors do their own thing. But essentially you have to be versed in science, like when you're in college or your IGCSEs, your science, your physics, your maths, any science-based subjects, just to go in that path itself. It takes a long time, but it's fun. And I would say if you're thinking about doing a chiropractor, make sure you visit a chiropractor and experience what it does for you. So at least you have a clear picture and say, you know what, I can decide whether I want to do. So before you even decide, try chiropractic, try physio, try acupuncture. Unfortunately, we don't have the profession or the university in Saudi Arabia. The nearest one would be in Asian countries, so like Japan, Korea, Malaysia, and stuff, Australia, or any of the US countries.
Okay. Any advice that you would like to give before we end up the session?
I would say to always find a second opinion. Back pain generally are back pain, neck pain, joint pain, any sort of pain. It's because of a mechanical issue. But I want everybody to know that there's always hope. Regardless, it's not with chiropractic, even with physio, with acupuncture, Chinese medicine, hijama. The thing is, I don't want people to get discouraged when they say I've tried it and I didn't improve. And when you ask or probe how many sessions did you take, they say I took 1 session or 2 sessions. Give your body a chance to recover with whatever you try. For instance, when you come in and see me, I've adjusted you 3 times and you tell me the pain is still there. You can't expect me to get rid of your pain within a few sessions when you've been complaining about the pain for 20 years.
Exactly.
So you've waited 20 years for your pain to get worse, and you can't expect me to get rid of the pain within a week or 3 days. So give yourself an option. That's why I said 3 months of conservative care for you to see there is an improvement. And the improvement can be as little as, you know what, today I slept better. You know what, I can walk further. I used to stand for 2 minutes, now I can stand 5 minutes. It can be as little as that, but it's towards the right direction. It's way better than you jumping the gun and saying, I'm going to go ahead and do surgery, or I'm going to go ahead and wear a brace, or I'm going to go ahead and do some extreme procedures, which might eventually not, you might not even benefit from it, but rather cause more harm than benefit. So I would say give yourself a chance. If you have pain, go through the right channels. And to always go for a second opinion, never stick to the first opinion, to always look for another option. But as much as chiropractic is good for your body, I always find the benefit if you combine it with other professions. So seeing a nutritionist, seeing a physiotherapist, because it always has, because like I said, it has 3 reasons why you might have pain: a physical stress, an emotional stress, a chemical stress. So when you come from all directions, when you come in from the nutritional sense, when you come in from the physical sense, when you come in from the emotional sense, you as a human will benefit more. Yeah, I would say give it a chance. The best thing to do is always give something a chance. Yeah,
Jazakallah khair.
to be patient. Yeah.
Jazakallah khair for your time, and it was my absolute pleasure, and my accept my heartiest thanks that
Thank you.
besides all your busy schedule, you accepted my yes request on the first go when I talked to you to join my talk show, and I would love to take you again in my
No worries.
upcoming events also. Yes.
Yes, and I want to say thank you. It's very rare to find people who have a large following or a large community to always want to help within the community, because nowadays everybody's obsessed with having followers and stuff and not inviting or not introducing a new concept or a new idea to their followers. So I wanna say thank you to you for taking the chance and having your followers and viewers get a chance to hear new stuff or new approach to a disability in their life or a hardship in their life, or yeah, because back pain or any pain in any sense causes some sort of disability in your life. Yeah. So I want to say thank you, and I hope to have you in the future.
Definitely.
Yeah, and we can
Would you
discuss
like,
more topics in general. Yeah.
before ending, would you like sharing your business leads here?
So I'm most active on my Instagram. So Zahra ZAHRA underscore Cairo, CHIRO, and I will always reply your messages, even within the same community or group. If somebody wants to ask question, they can directly message me. You can find me in Muruna Clinic. I'm there from 11 a.m. to 7 p.m. I can share again the contact information within the group itself. Or you can call the clinic if you want to speak to me directly. Yeah. I'm quite reachable.
that I can see also. You are humble and a beautiful girl, and may Allah bless you reward you immensely. Jazakallah khair for your time. Thanks again. Assalamu alaikum. Bye-bye. 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 Assalamu alaikum. Today in my studio, I had Dr. Zahra, and I hope my session with her would bring awareness in the community, inshallah. What is Sayyidaat Global Group? What are its motives and what are its targets? For that, you can go to my YouTube channel directly by the name Ibrahim Qureshi, and my page by the name of Ibrahim Qureshi. You can follow me on my personal profile by the same name also. And what our targets are, you can go to my group by the same name, Sayyidaat Global. Send me the request and I'll add you in my group. Thanks for joining in, for listening to me. The main motive, the sole purpose of this show is to bring awareness in the community. And how successful I am, I would know by your comments and in my session, inshallah. See you next time, same time, same day, inshallah. By that time, assalamu alaikum wa rahmatullahi wa barakatuh.